The world of foam rolling can be a confusing one. Depending on who you talk to, foam rolling can do
Rictus Sempra!
or really only does.
Essence fresh and hot, and Pillsbury says it best.
Today we're going to take a look at foam rolling, what the evidence says, and what this thing actually does. Stick around and let's find out the truth. Hey everybody, you're watching a Physio Named Jonah. That's this guy. Today we're talking about foam rollers. Specifically, we're going to be talking about how foam rolling can affect three things. We're going to talk about how it can affect range of motion, we're going to take a look at how it can affect performance, as well as how it can affect delayed onset muscle soreness, that's DOMS. As we take a look at each of these, I'm going to try and break down what we know about foam rolling, what we don't know about how it can affect this, and looking at it from my perspective as a physiotherapist. As a disclaimer, I am not the world's foremost expert on foam rolling. I'm going to be giving you my clinical impression as a physical therapist, someone who's used foam rolling in the past, as well as taking a look at what the evidence says about it. With that in mind, let's jump into our topic today. Alright, so first off, we're starting with range of motion. Does foam rolling increase range of motion? Range of motion is how far a joint can move. Obviously, for a lot of athletic activities and avoiding injury, the more you can move, the better you can function. One of the proposed underlying mechanisms is that by rolling your body and your muscles over top of the foam roller, you're increasing blood flow to the area, as well as increasing the muscle temperature inside of it. Why would that increase range of motion? Well, if your muscles are more warmed up, it makes it easier for it to achieve lengthened positions and makes it less stiff. There are some other proposed mechanisms for why foam rolling would increase range of motion that have to do with breaking down fascial restrictions as well as scar tissue. Both of those are restrictions in how the connective tissue surrounding the muscles allows the muscle to move. These seem a little less substantiated and there's less sort of conclusive evidence. Overall, the findings on whether foam rolling increases range of motion are mixed, and it makes sense. It's really difficult to set these studies up because you have to create a very consistent foam rolling routine that each participant is going to be performing, as well as compare it to a control who's not doing a foam roll at all or is doing some other form of cool down or warm up before their sport. However, the studies that did find improvements often found when foam rolling was compared with static stretching, this is when the biggest improvements in range of motion happens. Kind of makes sense, right? Teamwork and all that. So why wouldn't you just do static stretching and foam rolling all the time if we know that's the best way? Well, there are undesirable effects on performance of static stretching in that it's been shown to show decreased output of muscle after static stretching. So as a principle, you want to avoid static stretching before an event. This is where foam rolling can come in, and is why our next category is going to be on this list. Does foam rolling increase performance? Man, that is so broad. What does performance even mean? Because this is so broad, the answer I believe from this section is going to be mostly no, or that it's very inconclusive at best. Can you jump further after foam rolling? Can you run faster after foam rolling? The findings seem to suggest no. The theory seems to be quite consistent with the proposed mechanism for increased range of motion in that if you have a muscle with a higher temperature and blood flow, it can act in a more warmed up state and increase performance compared to someone who didn't foam roll. Practically, this doesn't make a huge difference for us because you can increase that muscle blood flow and increase your muscle temperature through a comprehensive warm-up like you would be doing anyway. That said, even if it doesn't increase performance, it doesn't mean that foam rolling doesn't have a place in sport. This is because it does not decrease muscle output in the same way as static stretching does. So it is proposed that foam rolling could be an effective way for athletes to maintain that muscle blood flow and range of motion through that increased muscle temperature during breaks in sport, be it a halftime break, be it coming off for a moment during a substitution, things like that, where the athlete has come out and has stopped competition but has to go back in soon and wants to keep that level of preparedness. So this brings us to our final category, which is, does foam rolling decrease delayed onset muscle soreness, DOMS, and what does this mean? Delayed onset muscle soreness is a very natural occurrence after a workout, after an athletic event. It is the normal soreness that accompanies this. So why would rolling your body over one of these things have anything to do with decreasing that pain afterwards? Again, the proposed underlying theory is much around that increased blood flow. If you have increased blood flow to an area, you can increase the oxygen delivery through your blood to that muscle group. There is another proposed underlying theory, which is that delayed onset muscle soreness may have more to do with connective tissue soreness, and the foam rolling targets the connective tissues. I personally, as a physical therapist, tend to place more stock into the changes in blood flow, or the increase in blood flow to an area, as opposed to the change in connective tissue for standard foam rolling. Some studies have found relatively significant effects of foam rolling after an exercise period, which included increases in performance and decreases in pain compared to a control group that did not perform the same foam rolling protocol afterwards. So there is some evidence to support the use of foam rolling after a workout or after an athletic event in preparation for the next event. Time for some final thoughts and recommendations on foam rolling based on everything we've gone over today. Often opting for a thinner and denser foam rolling is the better choice because it's able to apply more pressure to your muscle. If a foam roller is thicker and it's squishier, you won't be able to apply the same level of force in one region, and that force is spread out over your body. Foam rolling can have a place before your workouts or athletic activities, but should not be the only thing you're doing. It can help to increase some range of motion, possibly, and we know it can help to increase your blood flow and increase that muscle temperature. A component of a warm-up, yes, it should not be the only thing you're doing. It seems as though some of the best bang for your buck when using a foam roller may actually come after the workout or after the athletic activity. If you pair it with static stretching, this is where we see the biggest changes in range of motion or effect of foam rolling, and it also seems to have an effect on the delayed onset muscle soreness. In conclusion, while foam rolling may not be we do have reason to believe that it's accomplishing a little bit more than
Fresh and hot, and Pillsbury says it best.
but this is often the case when there's two greatly opposed parties in a healthcare topic. The truth involves components of both sides. Wait, no!
Richter Sempra!
Pillsbury says it.